Meet you.
I just think we're, yeah, are you looking at?
Hey, Letty. You should probably find Eric, because I'm starting to see. Let's go. All right, let's go. Tell me when we're connected. I'm gonna start my speech first.
Do you want to go through the whole rigmarole? It's information.
I don't, I'm gonna read my script. And, we're gonna, this is a finance committee meeting, I know what to do. I got the guess. We don't need a quorum.
I just want to know what you want to hear from me.
We got this. All right, are we on? All right. I'm gonna go ahead and call the Finance Committee of the Cook County, Health System, to order. And I'm gonna ask, the secretary to please call the roll.
Director Harrington is absent. Director Robinson is absent. Chair Ryder,
Ryder is here.
and those directors also present, Director Bott,
Here.
Director Curry,
Curry is here.
Director Sorrell,
Present.
Director Kim, and Board Chair Ryder. Board Chair Taylor, I'm sorry.
Hey, hello. Don't worry, I'm not looking for that job. Finance sure is complicated enough. So we do not have a quorum, although we have, probably a majority of directors in the room. We do not need a quorum, for this meeting, because this meeting is being conducted informationally, at this time, and we will not be conducting a vote. I'm gonna ask, and if we do achieve a quorum, we will make note and add, committee members to the roll. Debbie, do we have any, public testimony?
We did not receive any registrations for today.
All right, great. I am gonna now, receive the overview of the, budget presentation, from our Chief Financial Officer, but I'm gonna first ask, if, our interim CEO, Eric McKitis, has, any introductory comments.
I do. Thank you, Director Ryder. Good afternoon.
Before you do that, I am gonna note that, Director Robinson has, joined the meeting.
So a quorum is achieved.
And now we do have quorum. And Joe, my friend Joe Harrington, has also joined, I believe that's a full complement of our committee, so the whole
That is
committee is
correct.
present. Sorry, Eric.
Okay,
go ahead.
no worries. Thank you very much. So we are pleased to present you, with Cook County Health's proposed fiscal year 2025 budget. It's important to know that this is a balanced budget. It holds us accountable for the ongoing good fiscal management we have seen in recent years, challenges us to grow in key areas of opportunity, and most importantly, strengthens our ability to carry out our mission. I'm proud to say that our government-sponsored health system is increasingly operating more and more like a private nonprofit peer. Efficient, disciplined, and strategic. We're doing this while keeping our commitment to care for all, regardless of ability to pay, as our true north. I just want to take a moment to reflect on the progress that the health system has achieved in just the last few years. This includes increasing our leapfrog quality scores from an F to a B, as well as our star ratings from 1 to 3 stars from 2020 to 2023, sustaining an increase in our patient satisfaction scores in our ambulatory clinics, as well as building out the Office of Behavioral Health and the Office of Life Science. Importantly, these improvements did not come at the detriment of our fiscal health. CCH operated with a deficit in 2019, but has ended every subsequent year with a positive variance. With this budget, we're continuing the significant progress on the path that system leaders, both past and present, have been charting over the past few years. Key drivers in this budget include growth in key clinical areas, including our new health center in Bronzeville, stabilization of our county care membership post-redetermination, the provision of comprehensive services to new arrival patients, continuing progress in coding and reimbursement, as well as implementation and sustainability of ARPA-funded programs. That's not to say the next year will be without its challenges. Like every other health system, we're faced with increasing costs for labor and supplies, the need to make necessary upgrades to our IT and facility infrastructures, and the shortage of healthcare professionals locally and nationally, which continues to frustrate our recruitment efforts. Despite these headwinds, we're confident that Cook County Health is in a promising position and poised for continued success in 2025. Before I turn it over to Pam, I'd like to extend my deepest gratitude to this board, to President Preckwinkle, and the county board for all of your ongoing leadership and support. I'd also like to thank Pam Casera, Scott Spencer, Joe Francois, and the entire finance department for their efforts to develop this budget. And lastly, I want to thank our Cook County Health team for their exceptional contributions to the health system on behalf of the patients, members, and residents we serve. Now I'm happy to introduce Pam Casera, our CFO.
And before Pam starts, I would just like to reiterate something that I said earlier in our board meeting, and that would be that the budget is being presented for the first time, and we're presenting it for informational purposes. We'll be conducting hearings, and I would just ask that directors hold their questions for the briefings that we'll have, and then our next finance committee meeting.
Great, thank you, Chair Leiter. All right, so next slide, Debbie. We will start out with some of our fiscal 24 accomplishments and key initiatives. For the newer directors in the room, we'll have a quick historical overview, then we'll hit on the budget, touch on our special purpose funds, and then we have always have our appendix of abbreviations for you as well. All right. So first, we like to start with a look at how we're doing this year. So as a reminder, we try to align everything we do around our strategic pillars: patient safety, clinical excellence and quality, health equity, community health and integration, patient experience, growth, innovation, transformation, optimization, systemization, and performance improvement, workforce talent and teams, and fiscal resilience. So there are many non-financial achievements listed here, but the ones that most impact our financial performance and budget are the items around expanding services, improving operations, and/or reducing waste and expenses. I won't read all of these to you, but a couple call outs. On the left, the top point mentions entering into value-based contracts, which will give us increased reimbursement. On the right, the top right, all help to increase volumes, opening neurocritical ICU, launching the Cook County Health Express Care, expanding telehealth at CERMAC. Then the second bullet as well, all the capital equipment due to no downtime and broken equipment, the mobile MRI, the ultrasound machines, the endoscope replacement also all help to increase volumes. And then on the bottom bullet, the revenue cycle turnaround plan continues to increase our collections and reduce denials so that we can reinvest those dollars into services to our patients. Next slide. So looking forward to 2025, you'll see more of the same. Generally, we're looking to continue on the path we've started over the last few years through a combination of expanding services or decreasing expenses through standardization, centralizing, or consolidating. A couple call outs on this page as well. On the left, you'll see continuing to grow the service lines, behavioral health initiatives. And then on the right, as Dr. Markaitis spoke to, continuing to expand at Provident and our Bronzeville Health Center. And then you'll also see a lot of words like optimization, streamline. Again, we're looking to increase throughput and/or reduce expense in FY25 so as to remain financially viable in the years ahead. Next slide. So a quick historical overview. This slide will give you some historical perspective. You can see the trends over time, and this is important because as we build our annual budget, we start with volume. You can see that since the fiscal year 20 dip related to the pandemic, all key volumes are showing slow but steady growth. Next slide. This slide I call our where we've been and where we're going slide. Going back to 2019, you can see we had a pretty big negative or deficit of nearly $500 million. But we've enjoyed surpluses the last few years driven by the pause on redetermination during the pandemic as people were able to retain their insurance coverage, along with Medicaid expansion to our resident immigrants, strategic service line growth, and good fiscal management. Additionally, on this slide, you can see the lines coming together in FY25 to a zero, in other words, a balanced budget. And then in the out-year projections, the expenses start to exceed the revenue. However, management would be expected to address any projected deficits through a combination of revenue growth and/or expense reduction. Next slide. So this slide shows our budgeted FTE trends over time, which is also important as our salaries, wages, and benefits comprise over 51% of our operating expenses. In most recent years, fiscal 21 through 23, the increases were related to expanding services around the specific strategic initiatives, addressing the needs related to COVID and the asylum seekers or new arrivals. And then last year, there's a decrease where we implemented a 308 FTE reduction of vacant positions only that was related to an exercise around productivity benchmarking and right-sizing the organization. And then for FY25, we budgeted flat or the same as FY24, so no additions nor reductions. Next slide. All right, so moving on to the FY25 proposed budget. On this slide, we have our base budget assumptions. The overarching goal of the budget process is to come in with a balanced budget, which means our expenses cannot exceed our revenues. And since volumes and membership drive the revenues, we start there, as we don't know how much expense we can cover until we know what our revenues are going to be. So we begin with the current year actual projected volumes and add or subtract for known impacts from there, as illustrated on this slide. And as Dr. Makaitis has mentioned, fiscal year 25 budget is basically a continuation of strategies we've been working on the last 2 years, especially around growing services at Provident and continued ramp up of the cardiac, neuro, and cancer service lines at Stroger. Next slide. This slide shows how that thought process translates into numbers, and these are the key volume statistics that drive the budget. So again, we look back at how we've done, we look at the current year and whether or not we're meeting budget, and then we look forward to next year's budget. These volumes represent very reasonable and achievable growth based on current year run rates and planned and continuation of the planned strategic initiatives. Next slide. Which brings us to a proposed budget, FY25 budget of $5.146 billion. First, looking at revenue, this is an $890 million or 20.9% increase over FY24 budget, but it is a reasonable and achievable $178 million or 3.6% increase over this year's projected $4.968 billion. Touching on the biggest variances in looking at the breakdown, you can see the largest piece, $691 million or 78% of this increase is coming from county care, and we'll get into their assumptions in a later slide, but generally they've been doing so well, as Aaron just reported, retaining their membership and exceeding their budget, that we decided to go with a more realistic membership target for FY25. On the hospital clinic side, $143 million increase over FY24 budget, but a $16 million decrease from this year projected due to anticipated increases in charity coming from both the budgeted increases in volume as well as the shift in payer mix or decrease to Medicaid related to the redetermination process. Next slide. Looking at the expenses, balanced at $5.146 billion as well. We'll go through each office in a moment, but the large increases in expense are primarily, again, coming from county care or health plan services and Stroger. On the FTEs, you'll see that we're flat, no increases or decreases in total. However, there are shifts between offices that were made to achieve various strategic initiatives. Next slide. So now we'll go through each office, starting with Stroger, going up $130 million and 8 FTEs. The key expense drivers of that increase is continued ramp up of the service lines, again, cardiology, neurology, and cancer. And then increased medical and lab expense services due to cost inflation, increased volume and addition of robotic-assisted surgery, increased pharmaceutical utilization, investments in information technology, and use of medical consultants to cover physician vacancies. There's also the half-year impact of the 5% COLA increase, which impacts Stroger as the most, as Stroger has the biggest bulk of our workforce. Next slide. Looking at Provident. $12 million increase in expense, 38 position FTE increase due to new and expanded service lines, the Crisis Triage Stabilization Center, neurology, stroke, GI and women's service lines, PT, OT, and speech, and a new dedicated observation unit, as well as facility infrastructure upgrades and investment for the aging campus. Next slide. Our outpatient ACH and core going up $33 million in 3 positions. Their key expense drivers, expansion of virtual care and urgent care to select clinics, the new Bronzeville or 31st Street clinic opening this fall, and then the continued health needs of new arrivals. Next, looking at correctional health, an increase of $12 million, a decrease of 6 positions the expense drivers, the telehealth service phasing, maximizing use of technology to provide efficient, effective, and safe service. And then the reduction in FTEs reflects staffing and programmatic realignment under the Office of Behavioral Health to meet clinical needs of increased mental health demands. Next slide. Public health, increasing $2 million and 2 positions. This is being driven by communications initiatives for expansion of advertising of the CCDPH services to the public, and then their new Oak Forest warehouse facility for vaccine distribution that was just presented in the prior meeting. Health administration, going up $35 million and going down 47 positions. The key drivers here are continued investment in the rev cycle, HR, and supply chain functions to increase revenue, expand hiring and optimization, and drive operational efficiency. Continued expansion of the life sciences department to support research operations. And then the reduction in positions reflects transfers from the position control committee pool to other offices to achieve their strategic initiatives. Moving on to health plan services or county care, going up $662 million and 2 positions. Again, this all revolves around the increase in membership over the prior year budget. We used an average membership of 392,301, which is a decrease from FY24. And then the revenue per member per month is going to increase due to utilization cost trends and program changes. They use a medical loss ratio of 93.6%, and all other expenses are expected to be in line with prior years. The next slide shows the anticipated membership decline over the course of the year. And again, you'll see this year we went with very small incremental, couple thousand a month decreases, and used a much higher average of 392,000 than we did in prior years. Next slide. This slide just shows the projected membership for each population and the contribution or the net gain or loss by each plan. The total $142 million contribution margin, $142 contribution margin average equates to approximately $56 million positive to the health system, coming from both the domestic spend, which is county care patients that use CCH, and net income of the plan itself. All right, now we're going to touch on our special purpose funds. So special purpose funds and grants are additional monies on top of and not included in the $5.146 billion FY25 health fund budget we just reviewed, and are an essential part of how CCH is able to continue to provide needed services beyond the traditional healthcare, hospital, and clinic setting. These grants broadly categorize and address such issues as behavioral health, opioid and substance abuse, food as medicine, COVID-19 and emergency preparedness, trauma-informed treatment, and healthy children and families. For FY25, we will have almost $100 million comprised of over 85 separate grants and 350 additional positions for FTEs to help us carry out this important work. And then since ARPA is almost half of the $100 million on the previous slide, just as a reminder, ARPA was the American Rescue Plan Act of 2021, which included $1.9 trillion of federal stimulus funds to hasten the recovery from COVID-19, of which Cook County received around $1 billion, who in turn designated almost $179 million to CCH for various initiatives categorized here. And so, as we talked about in the last meeting, we would hope at a third of the way through the award period, we would be about 30% expended. This shows we're currently at about 26.5, but should soon bypass that with the recent Stronger Together sub-recipient awards totaling $45.3 million. We hope to accelerate that, targeted at resolving behavioral health inequities across Cook County through expansion of access for early intervention, prevention, treatment, support, recovery, and crisis assessment. And that next slide concludes our FY25 budget presentation. I, too, would like to thank my finance team, especially Budget Director Joe Francois and Associate CFO Scott Spencer. And I will turn it back to Chair Reiner.
All right. Thank you, Pam, for presenting the budget. Now that we've received the budget, we're going to, I want to make sure I use the proper word for this. We're not going to adjourn. We're going to recess the meeting. We're going to recess the meeting for our first public hearing, which will occur on August 2nd. And is that, I don't have we'll also have another hearing on, August 5th, and then after we've had that hearing and received public testimony on August 5th, we will then, continue, we're going to then, recess the meeting on August 5th. No, we have a special,
This is an informational meeting, so we won't have action at the end. It'll the budget will be placed directly on the August 15th finance agenda. So, we would just adjourn this meeting on the 5th. Does that make sense? Yeah. Oh, I'm sorry, I misunderstood you.
We'll be adjourning on August 5th, and then, taking, again, getting a presentation on the budget, and on August 15th, where the committee will then, which is a regular committee meeting, where then the committee will take, again, take questions, from the committee, and then, consider taking action on the budget at that meeting. And if, whatever action we take on that meeting would then go to the full board meeting at the end of August. Does everyone follow the process? Is there any question on that? That doesn't mean someone won't have a question. Joe?
Yeah, based on the, public hearings we're having, do you think the budget will change, or have we done it in the past? So the budget that we've seen now is gonna be the budget moving. And will there be a summary of the comments? It'd be interesting for us to get some idea. I plan to attend one, but not both.
So, Debbie?
So anyway,
Let
I'm sorry.
me explain the first part, and then we'll get to the second part, because there's two questions there. So the first part of the question is, the intent is that we present, that the staff and the executive team has put together a budget that they can stand behind, and that they had briefings and discussions with their counterparts at the county, that fits into their larger budget. There has been, because commissioners will also be briefed, based on input from the public, from the members of the finance committee, from members of the board, the commissioners, there can be adjustments, and has been in the past, adjustments to the document before we take action on it on August 15th at the committee, before the board takes action at the end of August. There is also the chance that after it's gone through those processes, the commissioners will then make further adjustments. Our experience has been that in the last few years, if someone can validate this or not, that the last few years that there's been minor to no adjustments to the budget as presented all the way through the end of the process, because we've gotten very good and very efficient at this over the course of the last 4 years. So, it's a big messaging, data, and hugging exercise. And hugging, I mean bringing people in and letting them have the transparency to see why we're doing things. I expect that we'll have robust briefings. So, and that's, please, I know we're trying to make sure that we're expediting this first process. I think the real work for the members of the committees to get, your feedback and your briefings and your questions. So come with those questions and feedback fast and furious, because if there are things that you have questions about or want to provide input on, sooner rather than later. And now that you have the document, take it and take it home with you and analyze it, make notes, and start developing, your questions for the briefing meeting.
Eloquently stated.
On your second question, in terms of summary of public comment.
Yes. So, following the conclusion of the special meeting and the public hearings, you will get what looks like minutes with any written testimony attached to it. And additionally, I can provide links to the recordings of the live streams where you could actually go back to each of those, because we'll accept testimony at each point, like 5 points by the time it hits for board consideration. So, any of those hearings that you might have missed, you can always watch on YouTube. I can give you the link.
And there's a fair amount of people who provide their written remarks with their oral, public comment.
And that's attached to the minutes from that special meeting.
Okay, Mr. Chairman, I have a question about the questioning process itself. Thank you for the presentation. I have found, in my estimation, a conflict in information that was just presented in an earlier presentation, what we just heard and what's in here. How do I handle something like that before? That doesn't need to go public necessarily, but where would I bring that?
Well, I mean, anything can't be, we do encourage transparency, but if you have a question, about something that you just heard, that you're trying to resolve with where you think we're headed, feel free to, reach out to, Pam or Eric directly and ask them, that question.
Sure. Can I ask a question?
Director Bott.
So one thing I didn't see on the FY 24-25, but I suspect it's embedded in here, is some of the conversation we're doing around investing in technology.
Correct.
And so any of those elements, not just capital infrastructure technology, but, approaches, upskilling, et cetera.
Yes, you are correct. It is embedded, and we can have those numbers for you when we meet with you.
I just, yeah.
Mhm.
Okay. Any other questions or follow-up? Hearing none. I appreciate everyone's participation, and I look forward to seeing folks on August 2nd. Again, if you have any thoughts going into either of the public hearings or into our next committee meeting, and you want to get a jump on your briefing, please feel free to reach out to Eric or Pam with any questions. All right. With that, we're going to hold the meeting in recess until August 2nd at 11 a.m. All right. Thank you, everyone.
Thank you.
Oh, and if you plan on attending, please let Deb know, so that way she can prepare for the amount of people that will be attending.
I'll send a quick poll out, just asking who's coming when, so I'll make refreshments, that kind of thing, make sure I've got enough and stuff like that. So I'll check with everyone.
Thank you.
Thank you.
Thank you.